What is this scar?
Just like you have it
Come on, what?
Was that your show?
She's on meds. She's on
medication
Didn't they all want
That's
Hey, no leaking!
vacation. Alicia, did you pull your car?
All right, so
Pull your car.
start with, first of all, a thyroid problem? Are you sure? Checked. How old are you?
42.
Okay. So when did this start?
34.
At age 34. Okay, so 8 years. Anyone in your family?
Mom.
Mom has rheumatoid. Okay, so genetic, presumably. Any heart to breathe?
I just have a really bad lung cold.
Any cardiac disorders in the family?
Yeah, I think my grandma had something.
Mama's side?
Yeah, all mom's side.
Okay. No papa? You didn't know papa? Or?
No, Papa is strong Romanian. They die, working hard, or just fall over. No medicine.
Okay, so no medical history on father's side. Okay. A fever as a child? High fever? Weird fever as a child?
Nothing that I can think of.
Okay. All right. So, is it more small intestine side, right? Not so much large intestine side?
Yeah, it's all like right. It's really right there.
Okay. 1, 2, 3, 4.
3.
3. Okay, so Yao Tong Shui is like, I mean, not quite, but yeah. 1, 2, 3, 4, 3. Okay. They snitched. They said you take medications. What do you take?
That's okay. And well,
Okay. Is it okay with you?
wow, I love it.
Okay.
I don't take it as much as they want you to take it every week and with other drugs. I only take that once.
Injection?
It's an injection and I take it about once a month. Every 4 to 6 weeks I take it.
When was the last time?
I think about a week, 2 weeks ago.
So relatively not so much pain.
Yeah, I mean, I really don't have that much pain. Since I had twins, or 4.5. Since pregnancy, like all of the really bad stuff was before that, and then I got pregnant. You want me to put my clothes back on?
No. Did you get pregnant naturally, or did you have
A natural.
totally natural? Did you take hormones?
No.
Never.
No.
I'm just asking.
She's my best friend.
No, it's like, how dare you think that?
No,
she
I
has
didn't mean to
hormones?
sound that way.
Lots of women do. The reason I ask is because some of some of these will create rheumatoid arthritis in my opinion.
The hormones.
I've seen it. Yeah, horrible. So that's why I'm wondering.
Yeah, I've
so it was
never-
worse
no
before
birth
pregnancy
control.
and got better with the pregnancy, and now you're on Ambro for how long?
Since maybe 4 years.
So pregnancy
Before
stopped.
that, nothing. Yeah.
Okay, before pregnancy, breastfeeding, then you start Ambro.
Mm-hmm.
Okay, gotcha. Any pain?
Yeah.
More this side? More this side. Okay, thank you. Any discomfort? I'm just looking, possible. Sometimes people don't know, but, okay, cool. How about, maybe we'll ask you about your digestion, other snitching. Would you like to tell me about Linda's digestion?
This is great. Why don't I know that here?
This is great, okay. Yours, okay, what's going on with yours?
I just feel like it's probably the root of the rheumatoid arthritis, just off and on, just chronic, either loose stools, and then after never constipated, but then when I got pregnant, a little bit of constipation. Now I feel like it's a little irritable bowel.
Okay.
Like it switches around.
What age did the loose stool start?
I think it's like around 30, something like that. Maybe 4 or 5 years before I got rheumatoid.
Okay. How, any gas?
Not now, no. Previously.
When?
I'm just thinking of like that pre-pregnancy thing. Now I don't feel like that's the issue. It's just more,
Are you cold?
no.
Any pain? Her knee is like, I don't know what to call it, but it's
Tight.
like tight, but it shifts all the time. It cracks. No pain. It's okay. Fine. Okay. So loose stools. Okay. And this is rheumatoid, and this is rheumatoid, right?
Yeah.
Okay. Did you grow very fast?
Did I grow fast? Yes.
Because you're kind of tall and like.
Mhm.
Okay. What age did that? What was that
I
spurt?
think like I remember being the tallest person like in 7th and 8th grade. Just like all of a sudden, so whatever that is, 12, 13.
I don't like this.
Not really.
And she's pulsing. Okay. Back. What's this bruise from here? From the injection? Here.
Probably, yeah.
Okay. Hi. Okay, son? Yes. Okay. Immune digestion. Digestion. Linda's digestion is in your.
Right.
Okay. Adrenal?
Yes,
Yes.
that's the worst.
Okay. How about this one?
Yes.
Yes. Okay. So adrenal both side digestion. Ren 9 pulse and uncomfortable. How's 12?
Does it? Yes.
Excuse
Feel
me
it.
for asking. Are you sad about something?
No.
Okay. No. Some questions better to ask like a total idiot. Like, excuse me, like a little. Let them do the rest. Yeah. No, because if you miss the point, it's like you look like a total idiot. And if you look like an idiot beforehand, it's okay. Nothing. I'm checking for something. But 12 no, and 21 no, but 21 this one, left 21.
Yeah.
How's 15?
Tiny bit. Maybe.
Tiny bit. Okay. How's 15 going towards the heart? No. Okay. 17?
No.
Okay. Boom. This is a spleen 9, by the way.
Yeah, kind of.
See, that's the problem. If you tell them what it's about, they start telling you something else.
No, it was. That's not so much.
What is the spleen?
Whole palm pressure. My finger touches the inguinal, but I'm pressing the whole thing. I'm not pressing just the whole thing, because below the tummy will show that way.
That's what that indicates.
It's a spleen 9 indication.
Are you pushing down? Or are you pushing
I'm pushing down.
You're pushing straight
Yeah.
down.
Down, not towards
Okay.
the left. Totally not.
Only a left spleen 9 or either side spleen 9?
Either side that shows. I think there's something here also. Actually, I'll get better angle.
Yeah.
And if
Yeah.
patient has rebound tenderness, that's also a finding.
Send them to the hospital, I don't know. To me, whether you're pressing in or whether they say ouch when you come out, that's what you mean by rebound.
Yeah.
When they come, same thing for me. Also, if they say radiate somewhere, it's as if the pain was where I pressed. Okay, so. I'm gonna lift it here. 1, 2, 3.
3.
And 1, 2, 3. Good? No.
Maybe a little. Well, now do that 3 again.
1, 2, 3. Okay, never mind, it's fine. Bottom of SCM on this side though.
Yeah.
This we know, okay. Hi, compare right side, left side. No. Right side, left side, yes, different. Okay, look, I can
Yeah.
get my finger in, I can't get my finger in. Okay, breathe in. Hold. Comfortable?
It's okay.
Okay. Romanian.
Very much.
In the back. 1, 2. No, very soft. My goodness. Okay. A little here.
Yeah, a little bit there.
And relax. Don't let me get it's okay.
What was that?
A little bit. Ouch. Just one test the other. A little below C3 on the left side. Otherwise, the cervicals were fine. Okay, so we have SCM on one side. The main thing is the Ren9 pulse, obviously. Okay, because that's kind of a, you know that the whole nervous system is, weak dantian, already weak dantian anyway because, autoimmune. Okay, so, all right. So now so now Kiiko will go and turn her over and do fine. She'll basically go, okay, dicky, and you had, how's your adrenal? How's your other adrenal?
Doing that? Yeah, it's better.
Better. Okay. So yes, it's true, but I prefer. It's okay. So I know I'll do it on the other side. No big deal. Why rush? Oh, and cough. Okay.
Sounds funny too.
Yeah, it's a cough that won't come out.
Mm-hmm.
No worries.
Another sting 9 indication.
Hmm?
Another sting indication.
Anything on Ren 4? No. Okay. So, you had Ren 9, adrenal on the right side, immune, full palm, a little on 15, right stomach 21, and number 3, and number 3. Correct? Okay. And kidney 2 pain. Okay. Okay. Checking against the dogma. This is 4 o'clock. How's 4 o'clock?
It's better.
How much better? Percentages?
Maybe 50.
50. Okay.
Where are you pressing?
Kidney 7. Kidney 2 pain, right? Height. How's now?
70%.
Okay, fine. How is this guy?
Gone.
Gone. Okay. How is this one?
Do it again. Yeah, it feels gone.
Feels gone.
90%.
Feels gone. Okay. If you don't give me percentages, I'm going to ask you to put your clothes on.
Okay.
With the needles on. And at 10. You okay? Then. Very loose feet. Now, how is this?
80%.
Okay. How is number 3 here?
100.
100. Okay. And sorry, and how is emerald?
Maybe like 50%.
Only 50. Okay, that's okay. The more they leave, the better. At the end of the treatment, you don't want to hear it, but at the beginning, it's okay. Kidney 10. I'll tell you if there's a whole new phenomenon going on, or I'll try. I'm not going to do 27 right now. Okay? Why? Because of the cough. I want to do something with a cough first.
Are you doing kidney 9 or kidney 7?
Kidney 7 plus 10. She had kidney 2 pain. Very weak pulse.
Can you read this, by the way, or is this not?
Yeah. Thank you.
Do people always have a problem finding your pulse?
Yes.
forever.
Forever. And is there anemia?
I don't think so. I mean, I get blood work every year or whatever.
Nobody said anything about. Okay, that's fine. 1, 2, 3. Anything?
One.
1. Okay, so kidney 27 can't do because of the cough. Does this make you feel icky? Wanting to cough? Ren 22.
Yeah.
Yeah? Okay, that's there. Relax. How's now?
It's better 80%.
How's this?
Better 90%.
Okay, lung 5. Cough, generally lung 5 indication, because remember I have to do kidney and lung. One, two, three.
One.
By the way, if it's kidney 27 and no cough, then it's a heart 7 indication. High.
90%.
Heart 7. Heart 7 is for clavicle bone problems. Okay. How's adrenal?
70%.
Okay. And this guy?
Maybe 80%.
Okay. How's this guy, the immune one?
And it feels fine.
Feels fine. Okay, fine. Ren 4 you had nothing, and you still have Ren 9, right?
Not really.
Not really. Okay, good. I thought the class is not so bad. Right? Okay. And you had boom, right?
A little bit.
A little bit. Okay. Okay. I'll try. How's now? No.
No, it's good.
That's good? Okay. And not so good.
That didn't change.
Okay, hold on. Hi. No. Okay. Yes, you have bumps. No? No change. Okay.
Yeah, that changed.
Okay. The best.
Yeah, I think so.
Spleen 5. Pancreatic tummy, you know, she only has one side, pancreatic tummy should really be across. She only has one side, stomach 21. But, so I was thinking maybe spleen 9, because of this, by the way. How is this now?
It's better.
Okay. So I think she has weak pancreas. That's why she gets the diarrhea. Oops, so sorry. Yeah. Okay. How's this guy? On what weight?
It's there, maybe like 30.
Okay.
First
And how's this?
That one's almost gone.
Almost gone. Okay, let's see if we can make him even more gone, just for the sake of it. Hello?
Yeah, it's gone.
Okay, so this spleen 5, I don't have a stomach 21 to check this spleen 5 against. Okay, but I still think, Kawai would have called this prevention. If you find one side, treat the other also, because the other side will get weak eventually. Okay. Okay, so. This guy still we have, right? Are you okay?
Yeah.
So, boom. You said nothing left here, right?
Maybe like just a tiny bit. I still feel it,
Okay, that's fair.
but really.
Okay. Rent
That
4.
I feel
You
now.
feel, okay, sorry. when I
Didn't
press
feel
here,
that before.
no, that happens. That's one situation you asked. Sometimes if I do the back, they'll start feeling more in the front. So okay. So when I press here, how is the arm, the hand?
It's gone.
It's gone. Okay, but you don't like this, so let's do it from the side. Hello. Point four.
Yeah, better by 60%.
Fabulous. So mushu. Okay.
What is the exact textbook location of Wushu?
3 scallions, 2 eggs, and hope the muscle doesn't break your needle. It's Ren 4, go all the way to the side. You didn't like that location. How high a level of Ren 4? Take gallbladder 26, go straight down, take gallbladder 26, Ren 4, combine them. But gallbladder 26 is straight to the side, so it's the same thing. Gallbladder 26 is not below the 11th rib for me.
Is it the same as gallbladder 29?
No, it's not.
TCM gallbladder 29, yeah, it's very close to it.
It's close, but it's not because
Is
isn't.
it exactly into the TFL muscle?
No, it's not the TF.
It's on the bone, it's on the hip.
It's above. It's above the trochanter. It can't be part of the TFL. It's above. The trochanter is here, and
Between
it's
the
above.
ASAS and the trochanter. And it will have either texture or it will be nice.
I need a bigger needle.
The yellow one, the yellow one. One by one.
Yeah, just take a look. I mean, it's like it's right on the midline on the hip.
Feeling it perpendicular towards Ren 4?
Find the point that releases the abdomen.
here on
The
the
point that releases, I get that.
Yeah. It
Look,
usually
Ren
feels gum.
4. Take all the way to the side. You have to get over the bone. And here, the TFL. This can't be the trochanter all the way up here.
Right, I understand.
Okay, so no, that's what I'm saying. It's definitely not in the TFL. I had to change needle. I had to get a thicker needle. Take a deep breath and out. Out. Good girl. Yes. Okay. Good. I have to win, not the muscle.
Avi, you were checking that against the wrist pain.
Against Ren 4. Hold on, the wrist is coming in. The wrist is coming. The wrist is coming.
It went for that wrist.
No leaking.
Yeah, but it was too uncomfortable.
Good. Sure. Okay, good. Okay, now, how are we doing here?
It's good, like 80%.
80% gone. Okay. Now I can do Ren 4 and see what happens. So, Ren 4 is okay right now? Fabulous. How is
That seems to get it.
to get it? Okay, fabulous.
What made you think Ren 4 or?
Autoimmune.
Oh, yeah, sorry.
I would add, don't you think so, but I won't. If you don't start sometime, it's like, okay, and then now fluffing. Even though she doesn't, I can still feel a teeny bit of the pulse. Before it was really quite significant. And I needle slightly out. Okay, Kiiko says 80 degrees out.
Is that the OD?
No, that's Ren 24, stomach 24. Slippery flesh gate for Ren 9. OD is gate of gate. Now, anything here?
Not really tiniest bit, like 10%.
This one?
or something. Yeah.
It can't have 10%. It has to have its own percentages.
What do you mean?
Every point is its own. Yeah.
Oh, okay.
Don't let people confuse different points with each other. Each point has its own 100%.
Okay.
Don't compare. Oh, this is more. I don't care if it's more. Does it have anything on it? Okay, so it has something.
Yeah, it has
Not a
all that.
huge amount. Okay, fine.
Yes,
How's now?
it's better.
Okay, that's all I care.
So that was an usher or?
Spleen 20.
Spleen 20. I can't see it.
Spleen at 20. Hello.
It's almost gone.
Okay, hold on. When we do mocks on liver, on lung 5, we have a better chance of getting more. Actually, before we do that, another trick point. Some. Some more.
No, it doesn't feel like anything. It feels
It's
like
okay.
it's, honestly, it feels like it's coming and going a little bit, like it goes away and then I don't feel anything now.
So when things come and go in your style, is it wind still or is it something else? Patient's imagination.
It's Joni Mitchell.
Seasons go round and round.
Everything comes and goes. Something, I don't know. That's my. Sorry?
You're singing.
Oh, my singing. Well,
Don't stop being an acupuncturist.
well, Joni Mitchell's a little hard. It's a little bit unfair.
Can you find mushu actually anywhere along that slice? Like if, say, the side?
Oh, I see what you're saying. I have never looked at it that way, but I suppose you could. This is for the cough, by the way. I think it's an interesting idea. Later. I believe you could conceivably, but then, then 13, 28, this whole thing. By the way, for us, kidney 13 and stomach 28, for you also, is it the same level?
Mm-hmm.
They are, okay, then it's the same line, then don't worry. The only thing is that, remember this is the well, okay, and the jing well, that this idea that you can affect it from the furthest away the better. If that makes sense.
Can you guys turn on the heater?
Let me know if that is uncomfortable or when you feel them. Okay, any questions?
How many cones do you typically?
They should feel 6 or 7. So I can't say how many I do because sometimes they don't feel for a while. But they need to feel 6 or 7 ideally. Now if they don't feel, who asked before, they don't feel, it's okay that they don't feel if their skin gets pinkyish. Because some people just don't feel, then you're just going to burn them. It's like, you didn't feel anything? I did 100 already. Well, it's like, so just make sure that there's some histamine reaction on this. I still have to do immune points, which is why I turned her arm over. You okay?
Avi, have you played around at all with the little bite away device that David did with us? Instead of the Moxie, I haven't heard it.
don't even know anything about it.
Actually, they're selling them in the New OMS catalog. It has a little metal heat spot, so it just creates heat, and it's pretty similar as far as the intensity of the heat. You don't have to burn anything.
I don't have the experience. I have to say, David likes gadgets. It's just his nature. And I think especially now that he doesn't have he and Gira don't have the zillions of Moxa people that they used to have, through Kiiko, basically, and they also don't live there anymore. They're now in Virginia. I think it's easier to have other people, when you don't have other people to do it, you have to find a way to do it. So it's gone though. Is that the first one you filled?
No,
Oh, okay.
it was just starting to get really hot.
Yeah, David also does lasers and all sorts of other interesting things that I don't know enough about.
So are you putting it on where the needle
Yes,
is?
where
You're kind of putting it on
the junction of the needle. It's kind of, which intensifies it ever so slightly because of the metal. Whereas if I just did it on somewhere else where there's no needle, it may take her a little longer to feel. Are you feeling? How's the coughing? How's the chest feeling?
Feels good. It's starting to relax. I feel like when I laid down, I
Yes, you
realized
were.
how hard it was to breathe and stuff.
How long have you been sick for?
A while, like a week and a half maybe.
So I'm sorry, this cough is a chronic cough, or is this?
No, it's just now.
It's just a
Oh,
cold.
okay.
Still worth treating. Even if I don't have a thing that sticks heat on. Any other questions?
So, when you did your list in the beginning for cervical stuff for SCM, you didn't even mention Xiaoyang. So
I did.
No, it just said kidney points and the two
Sanjiao
Sanjiao
8.
points.
Yeah, that's not Xiaoyang.
I thought Xiaoyang was when it was paired with the lower belt.
I told you
Not
yesterday.
always.
I told you yesterday that I've dropped the pairing many years ago.
Oh,
In
okay.
fact, actually, Kiiko has also more recently. But that's supporting part. So that's still Xiaoyang.
Okay.
The pair. Yeah. Okay. I'm gonna open my big mouth again. Hold on. Oh, it's okay. Give me a moment. Okay. In my personal opinion, very personal opinion, different people teach this technique differently, and we all have a concentration that we like. Okay? There are a whole bunch of people out, well, not a whole bunch, but a number of people out there that teach protocols. Do this for this, do this for this, and this is how it is. David happens to be one of them. Now, David happens to be one of the more talented people in his capacity to pass on protocols. Okay? That's his specialty, really. But for me, the style is not about the protocols. For me, the style is about Kiiko getting all confused and going, and I don't. Yeah. This is when it becomes interesting. Okay, it's the creative part that interests me. The protocols. I once sat with Kiiko at Pacific Symposium, and Shura Denmei was there, and a friend of mine who was working in my clinic, Japanese woman. She goes to Shura Denmei, he's Japanese, and she should see, right? To pay the respects, whatever. And so we're sitting at lunch, and my friends, Kiiko says to her, so how many people did you treat? And she says 11 people. So of course, that afternoon, Kiiko had to treat 11 people because she's got to be as good as, it's okay. But so Kiiko says to her, no, it's interesting what kind of lessons we get, where we get the real lessons from. Okay? So Kiiko says to her, it's a little competitive. Okay, big deal. She says to her, well, so what did they say? They get off the table. What did they say? She says, they said it's okay. The subject was neck and shoulder, whatever. And she said, so did they say it was a good treat? What did they say about, so my friend says, oh, they said, oh, good treatment. I said, how is their neck? You know, I don't know. So you're having 10, 11 people, and you didn't ask them, they got on the table for their neck, and you didn't ask them how their neck is. It doesn't make sense. And what Kiiko said at that point was this: it's impossible that 10 people get on the table, at least one gets up and says, no good. At least one, if not three. Okay? You can't work just with dogma. You know, so the protocols, and what she says then was, I'm not interested. I'm only interested when it doesn't work. That's when I'm interested, to see what is he going to do next. Okay? So there are a whole bunch of people who do this Kiiko Matsumoto fundamental class, whatever, and great, you need this. All I'm saying is I am not interested personally because I'm interested in the creative part of it. So the ones who don't have the creativity, it's like I already have the protocols. I don't need to study with David or with anybody, any of those people. I will study with the one who's going to show me something like, here are the protocols and here is what I do that's totally different. That's what interests me. Okay, the struggle, with the patients the rest you can read in the book. So the book, the book gives you some points that maybe are not, the essential points and the non-essential points are a little bit mixed or whatever. So you'll add some points that you didn't need to necessarily. I don't care. The book doesn't matter. I mean, so that's the part that, if David will add gallbladder for you, because that is the official protocol, and David's very careful to teach people, give them a good base, so to speak. I'm not interested. That's not my job. Does that make sense? Anyone else?
So I'm going to ask the patient a question.
The patient,
So
okay.
What will you expect from the street? We might expect her cough to get better because that was a symptom that we can notice. But with the RA, what would be?
Okay, RA, you can't. You can have less.
It's not going to go away, I realize.
No, maybe yes. I
Maybe
wouldn't
yes,
say.
maybe no, not tomorrow.
Maybe tomorrow. I don't know, but I'm not expecting. The thing is, so you want the pain a little bit less each time. Some people say, wow, 80% better, and then they'll go through that for 3-4 weeks, and then they'll say, oh, well, it's coming back a little bit, whatever. But yeah, you want the pain to get reduced over time. It can be fairly quick. I don't, in my experience, first of all, anybody with adrenal, anybody with Ren9 pulse is 3-month treatment, weekly treatments, right off the bat. Then you can start reducing. So then you can sort of say, okay, let's reduce to 2 weeks, let's reduce to once a month, whatever. But yeah, you want to keep treating. First of all, you need the money, no. But no, it's basically adrenal and or Ren9 is a 3-month minimum, routine treatments. And so it depends on, it's hard because then you're back to the standard answers. Let's try 10 treatments, see if it works. The only difference is, don't come back after the 3rd or 4th if you've got absolutely nothing. That's the difference. When people call and you're supposed to tell them 10 treatments, try 10 series, sell them a 10 series or something. That doesn't work for me. So I can tell you, listen, it's going to tell menopause. Every single one, let me just do the immune point on the other side. Every single woman with menopause comes in, at least in New Hampshire now. Oh, okay, I see what's going on. The shoulders not happy. By the way, if somebody wants to touch her immune area, please do.
Somebody what?
Her immune point area, it's like a puffy balloon. It's swollen.
Oh, yeah.
And she can't turn the shoulder either.
Oh, wow.
Yeah. This side wasn't so bad, but this side is definitely. Menopausal women, anyway, it's because of the bone structures. Anyway, menopausal women, you say to them, I say to them, you will, in 3 weeks, you're going to come back. I'm telling you, it's 3 months, weekly treatments, and then we can start reducing. Okay? because it's an adrenal treatment. It's adrenal spleen treatment. So they say, oh yeah, no, I'm really committed. I want to get rid of the hot flashes. I said to her, in 3 weeks you're going to come back and you're going to tell me how your hot flashes are gone, and you don't want to, and you can now come every 2 weeks. Oh no, I won't do that. Every single one. 3 weeks later, 4 weeks later at the most. My hot flashes are better. I'm unique. I'm better than everybody else. I don't need to come every week. Can I come every 2 weeks? What the hell do you want? Okay? So they come every 2 weeks, and I tell them, you can do what you want. Chances are, in 6 weeks, you're going to blame me that your hot flashes are back. It's like clockwork, you know? And they come back. If you are adrenal, you can't just treat for a short period of time. It's got to be consistent for about 3 months.
Will you affect the bony changes with the rheumatoid arthritis?
Sorry? Of course I expect changes.
No, the bony changes too.
No, that I can't. No, that I can't.
I don't really feel that cold.
Avi, how do you integrate with other modalities?
Yeah, like on my chest.
In your clinic or with other practitioners? I'm looking at the wrist, and as a manual therapist, I just want to do some alignment work. The bones are not in place. So.
Yes, I understand that. Well, okay. So you're asking what I do. Okay. Well, you saw I did the stretch on this person. I do other things. Okay, but I'm gonna, for doing that, I have to wait for a while. You know, I want to do the needles first and then figure out what else to do. So yeah, I may give her, you know, I would probably suggest to her, are you okay?
Okay.
So cough. I'll get out of the way. But it's looser. For her, I would suggest to roll a towel and to lie over the towel to see if I can get this going. I haven't really quite examined what's happening in that shoulder. Let me look at the back first and let's see what happens because I don't know yet.
So you place the little towel like across C5 or something.
No, not on the neck, sorry. So, you know, but you have something underneath here because most people would just, you know, crank here. So you want to be like this on a pillow. So then if this gets opened up, or when she's lying down, she can't do this. It's hard for her. She does like this. So what you do is if you put her like this, it'll be easier for her. A lot of people don't like this, so then I cannot needle immune points in this position, but I can needle them this way and they're like this, and then I reach on the arm to here. Okay, that's more comfortable for most people. It's just that they're constricted in whatever the gland
I
area.
use those pulse pillows. I never use it for pulse. I use it to pump up the wrist in that position. Yeah, so the shoulders.
Oh.
Oh.
There's a whole hospital happening here.
She's well loved.
Once the needle's ready, you can do anything you want. So here, you do this, and you do that. You can't really cough.
Avi, can her shoulders could be from her rheumatoid as well, right?
It could be, well, yeah, we don't know. I think it's coming somewhere between the shoulder blades. Let's just, yeah, Linda's already saying yes. It's a digestion and a shoulder blade. Any other questions? I warned you that today is question day. No, because really, material-wise, there's only so much I can
So
offer
then
you.
the digestion,
Yeah.
what are they?
We did spleen 5 for her, which is, I mean, you're looking for spleen type stuff. I mean, because I think comes from the weak pancreas.
So spleen 5 for weak pancreas?
Yeah,
Okay.
adrenal plus spleen 5 plus lung 5 is pancreatic abdomen.
So you did, and you got spleen 5 because she was sore under this,
That
right?
would have been
But-
officially, this whole palm pressure is officially spleen 9 indication. However, the spleen 5 is for stomach 21. I tried spleen 9, didn't do it. So I tried spleen 5, and that did both the full palm pressure and the stomach 21.
And stomach 21 left.
Stomach 21 left.
Okay, thank you.
Left. I hope it comes back without any pain.
For the pancreatic stomach, for some obscure reason, I don't know where I got it, I do 5 and 9. Is that okay? Or
It's okay, especially if you have spleen 2 pain, but 9 is not. No, I don't know. I'm not sure where you got it from.
No.
5 and 9. No,
I don't
I
know
only
where I
heard
got
5.
it from.
5 is the
Just
anti-inflammatory. Yeah.
5 is anti-inflammatory.
5, spleen 5 is an anti-inflammatory point. So is liver 5, by the way. So that's why spleen 5 is the anti-inflammatory point on the spleen channel. Therefore, for pancreatitis, itis. Okay, it's anti-inflammatory.
So, question about how you differ from Kiiko a little bit. Okay, so I've seen her in the past when Red 9 pulsing happens. She's like, that's got to clear that first
Yes.
sometimes. And
Yes,
so,
I agree.
but
I
okay, you're saying
didn't.
you clear it by not using red stomach first. Okay, I got you.
I didn't clear it, I still need stroke
still did
before,
clear.
but I go for other things.
Okay.
And I'm still checking this Red 9. So what she's saying is it's of primary importance. This Red 9 pulse, if you don't fix Red 9 pulse, the person, you have this spiraling thing that's happening. If this whole thing quivers, instead of going like this, it goes like this. Your whole entity as a human being, it's a little overstated, is kind of screwed up. Okay, your whole central axis, your whole communication between the dantian doesn't work well. Okay? Therefore, this Ren 9 pulse, this thing that goes kiki or up and down like this, that needs to be resolved because you don't have a central axis anymore. Now, that's the way I'm expressing it. It's not, Kiiko won't express it quite in those words, but that's my understanding. So yes, this is of primary importance, okay, because it's an indication of Ren 4 in some ways. So because for you, Ren 9 doesn't mean anything, right? I mean, for you, right? Like TCM was, who cares about Ren 9? It's like, okay, what's the location, whatever. That's one of those points. But
Isn't Ren 9 where the long meridian starts?
Ren 12.
That was-
It goes, Ren 12 goes downwards and up. No, Ren 12 is the beginning of the long meridian. Now, the navel itself, by the way, the reason we call it Ren 9 pulsing is because really it should be called Ren 8 pulsing. Now, the name for Ren 8 is Shenshui, which means the watchtower for the spirit. Okay? So that it has a primary importance, this area. But we generally kind of like, and also this is where you came from. So this is very important, but somehow at TCM we're always talking about the lower dantian, lower dantian, lower dantian. Okay? But this in some ways is an indication of what's happening down here. And its communication. Okay? The human body is basically, you're made of 3 areas. Okay. One of the dividing factors is the diaphragm. Okay, so you have your inguinal, and then you have your diaphragm, and then you have your neck as dividers between these, 3 jowls, if you like. Okay, so you've got to be, your communication between these areas is of primary importance. Once this is disrupted, this is an indication. Okay, that's got to be fixed before you do anything, I don't know, it's not so much before you do anything else, because what do you mean before? It's all happening in 5 minutes. Like, what does it matter, 1 moment before? But don't leave it alone. Don't let this happen. Okay?
Yeah.
Address it. That's my understanding of what you mean. You want to address it with the right stomach 24, address it with right stomach 24. As you see, in my case, I tend to do the mushu first.
Yeah.
Which Kiiko, I don't think Kiiko would, if you said to Kiiko that, what about mushu for Red 9 pulse, she'll go, eh? It's not her vocabulary. No, it's her point, but it's not her vocabulary for this particular thing. In 6 months, you never know. She might say, oh yeah, Musha is for, you know, and I don't know what will happen. It doesn't matter. Make sense? Let's flip you around. So, and the other thing is, remember this idea of starting at the basement? Starting at the foundational level. So if I start directly, you know, with Ren 9, but I have things underneath it, to me aesthetically it's not very pleasing. No, seriously. Okay, have you seen, like this needle is, oh no, it's not my fault. That was not an aesthetically pleasing needle. The angle was totally wrong.
How do you like the Mushu angle?
Sorry? Actually it is a 90 degree. I mean, maybe slightly towards the head, but 90 degrees. Every rule has its exceptions. Yes?
What ended up getting rid of immune pressure putting?
I didn't. I did immune only this side, not that side, because of that. I'm going to try small intestinal level area for it. By the way, I want you to notice how, excuse me, see how this foot just drops? So that's another very interesting thing for me. I don't like it when the feet are flopping over. Yeah, but it's just not, I mean, the fact that you can stretch it, it's one thing, but the fact that it
just hangs over.
Yeah.
What does that suggest to you?
That there is not good holding in the nerve, you know, like people with strokes, for example, that there isn't good integrity. How are your wrists? Carol, where are you? How's your?
It's coming and going.
Everybody's coming and going. It's a Joni Mitchell thing.
Some windows where it was barely there, and then some windows. Last night I did some extended walking, and it was more pleasant. And this morning it was pretty good, and right now it's pretty good, really pretty good. But so more with movement, it seems to come.
Gotcha. Okay.
But still, I can do this motion right now, and it's not too bad.
Can you turn me over? Go up. Here.
Want something lower under your feet?
Whoa.
What's
More
wrong?
comfortable? She was like totally hyperextended. This side. Is there any discomfort when I press here?
Yeah, it's tender.
It's tender, okay.
Ouch.
Ouch, okay, sorry. How's immune point? Remember you have the elbow?
Yeah, it feels 60% better.
Okay. Ouch. This is, we call lymph, this is not small intestine 11, this is lymph points for lung infections. How's now? It's under small,
90% better.
90% better, okay, fine.
Where are you?
Okay, you take small intestine 12, but you go under the scapular spine and needle into the scapular spine. Or whatever you call this thing.
Scapular spine, yeah.
Come on, what's wrong?
What's the name of your point?
What's that?
Lung infection, lymph node points.
It's under scapular spine points. It's for the lymph.
Cool. You don't want to be needle, do you? Oh,
pretty gummy there?
It's tight. So it was breaking, it was kind of trying to break the needle. It didn't want to be needle. Okay, now. Okay, so now you're seeing a little bit more of what's happening. You're seeing this area here. And I think that's what's preventing the shoulders. Okay, do you see this? Okay, so I think that, I just want to see where things are coming from before I make up my mind.
So what are you seeing, like in an
I think this area here is
Because
that
it's tight.
painful? T5?
Yeah. Yeah.
More on the right side, huh? Okay.
Because it's curved?
Yeah, and it's also it's both kyphotic and it's curving this way, in my opinion. Look at it. This side is more raised than this side. This one side's flatter. Okay. So you said G, right? Okay. So how's now?
It's the same.
Same. Okay, that's fine. She's autoimmune, so okay. So we can do L5, remember, for autoimmune, but in the back I can also do UB27, but I want this side because. Okay. How's T5?
It's better.
How much better?
90%.
90%. Okay.
And this one's because.
Autoimmune, friend of friend 4. This is small intestine shoe.
But different pulse types, though, right?
Different pulse type. She doesn't have a pulse.
Okay.
Doesn't matter fast or slow. She doesn't have one.
So if you do both, she'll get a pulse.
A lot of people I will do both actually, because this is also sacroiliac. You know how you in Japan you did this UB53. It's basically what we used to call sacroiliac before. Now suddenly it has a nice point name. I have to come out of the sacrum and fall, and touch this here.
Is that called Yao Yang too?
No, Yao Yan is above the iliac crest and it's the dimple.
Okay.
Yao Yan is quite a bit above it. This is on the side of the sacrum. Yao Yan is above the iliac crest.
Right, okay.
Oh, okay.
Told you, autoimmune people will have this weird feeling here. Well, I'm winning. No, it's winning. The gummy is winning. Okay, hold on. Gotta kill the gummy. How's T5?
Like 80%.
Okay, and this guy?
I don't feel that one.
Okay, 80%. Ooh.
Yeah, that feels it. Yeah, it's helping.
How much is left?
Doesn't feel like anything.
T11?
T11. I told you, T11 is like automatic. Plus, she has digestive issues, so pancreas. She has a weak pancreas. I have to fix pancreas.
So it's not really a Jaji point, it's like a little out.
You could go further in if you want for a Jaji. But because I'm needling towards the spine, in this case, I'm okay. Ooh, sorry, so sorry. And usually I would needle it upwards. But here,
Yeah.
this one won't.
Yes.
This one I will do upwards.
Why upward?
Remember, I want this area in the spleen, I want it supported upwards because most people fall backwards. SI shoe?
Is that what you call the
UB27.
butt points?
Small intestine shoe is
Yeah.
UB27, isn't it? I guarantee you it's true. Okay. How's T5?
It's good.
Okay. So, and I remember you had here, right?
Yeah, but it's not. Yeah, there.
doesn't have huge on small. Well, actually, I wonder if.
Yeah,
That's 11. Left.
Hmm? You got lost? Oh, you got lost because slight
They
S11
started
is
giving
the
up
is
on
the
it.
big deal that's
What is
basically
the
like
one-
Glen 4.
Going upwards, across from T11? Yeah.
This is sugar. This is also T11. This one, notice this one's closer to the spine. This one's slightly away from the spine. This one I did 45 degrees towards the spine. This one I did upwards. Because it was further away from the spine, I didn't do it upwards. That's why. Because I wanted to get the full
They're just
Watto if I
showing different
could.
ways.
Is that a little wide for the UB27?
This one?
For UB27?
Oh, yes it is, but, okay, come here. 32. Then, if you slide out, let me just get it. This is the end of the sacrum, okay? So it should be here. But I need, look how bony it is, how, you know, and then touch here and you'll feel much more gummy. You see what I'm saying?
Yeah.
So I'm looking for the gummy, not for the exact location. But you're absolutely right. Ideally, I should, yeah, because this is like outer UB line.
Yeah.
You know, but if I go for inner UB line, there's nothing there for me. You know, it's like you have to talk to a rheumatoid arthritis and explain the bladder channel to the rheumatoid arthritis and say, excuse me, you need to come to the inner UB channel. Gummy, please move to the inner so that I would be happy. That doesn't work very well.
Avi, on the left,
Yeah, that's
SI11 is for.
Officially cardiac, but in her case it's not. Officially, left was small intestine 11 was cardiac, right is digestion. She needs both. She said cardiac, maternal grandmother cardiac plus, regardless, autoimmune is small intestine 11.
Okay, I will read.
What's your angle insertion rationale on the
Yeah,
scapula?
that's better.
I'm surrounding the gummy. So there's no angle. I mean, there is an angle, but they're all pointing towards the center, basically.
The center is.
The center of the gummy. Here?
Yeah.
How's come and go?
Fine.
Come and go.
Yeah, fine.
So I want to do moxa on these lymph points.
What else are lymph points?
Spleen 5 is a lymph point, by the way. It just happened that way. It wasn't planned. I did not diagnose her as a lymph type person.
What type did you diagnose her as?
Autoimmune. Autoimmune specifically related to cardiac.
And pancreas.
So very interesting. This side I don't feel the same feeling under the scapular spine as this side. And this is the side. Is this comfortable? Okay, fine, do it. So this side is the side that, it's this side that the immune point was weird.
Yeah.
This side, the immune point wasn't weird. And the lymph area doesn't feel so, but, prevention.
That's the lymph area.
Hmm?
These are the same points that Kiiko uses for when people have had their lymph taken out?
Yes,
From
yes, it's
cancer.
lymph. It's originally for, originally it's lymph for,
Yeah.
hmm? Well, it's
Any
lymph nodes that were removed
Right.
because
Any
of
kind of
cancerous issues.
Well, if the lymph was removed, related to any kind.
But weren't there specific points she said for breast cancer?
Okay, small intestine 11 is breast cancer.